Very important. It's one of the best things you could do, as your heart beats 70 times a minute for however number of years you live. So it's going to be millions of times of heartbeats. And the heart is one of the biggest muscles of your body, and it needs fuel lines. You need to maintain it, make sure all those fuel lines are wide open.
It's like the power plant of your body, right? It's pumping blood that carries oxygen. And part of what you do at Varis Vein Institute is to make sure that, I loved how you equated it to fuel lines. If you're driving your car and your gas line's clogged, guess what? Your car is not going to operate as optimum as it can. Same thing with your body. If your veins are clogged, you're not going to be getting the proper oxygen to your various parts of your body and nutrients and things of that nature. So you are a vascular and thoracic surgeon. You are the owner and operator of Varis Vein Institute, now with 2 locations, one in Northeast Ohio, in Hallen, that you've been there for over 15 years?
About 18 years.
18 years in Hallen. And recently, you opened a secondary location in Western PA, in Hermitage, which is right over the border, kind of a little bit further east of Sharon. And you've been there almost 3 years?
Almost 3 years in Hermitage.
And specifically, just so the guests that are from outside the area or from in the area that don't know, what does Varis Vein Institute do?
We basically screen people for venous disease. If you have vein disease or symptoms in the legs like aching and swelling and throbbing, and your legs hurt, feel heavy, tired, you can't do your job, you can't stand at your job for a long time. We also treat varicose veins. We treat symptomatic varicose veins and asymptomatic varicose veins, whether it's for symptoms or looks. We treat spider veins, and we treat swelling, chronic swelling of the legs.
Is symptomatic and asymptomatic, is that what that is? Symptomatic is like, I'm having pain in my veins. Asymptomatic is, I got these ropey veins that look gnarly. I want to get them so they don't look so bad.
Yeah, correct. Majority of folks have symptoms. Minority of people with varicosities or varicose veins believe they don't have symptoms, but because they've come on so insidiously, people have gotten used to the symptoms. So once you treat them, then they say, my God, my legs feel so much better.
Now, do you get, would you have increased in energy or increased in production, like in terms of like I'm able to do more stuff because my body is functioning at a higher capacity because I don't have these blockages?
Absolutely. If your legs don't hurt, and if the swelling goes away and you can stand on your legs longer, you can walk longer, you can do your job better, you don't feel as tired, then you can do far more with your legs than you did before. So
I got introduced to Dr. Z. I'm going to say Dr. Z instead of Zarrinmakan 50 times because it's less syllables and sounds cooler. Dr. Z. I got introduced to Dr. Z about 10 years ago, maybe. I'm guessing here. We did some production work for him, some TV commercials and whatnot. And these are the type of guests I always like to have because you have a particular expertise in a field that can't be covered in a 30-second commercial or in a 2-minute video. And this is a longer conversation, and in getting to know him and his area of expertise, I found out that varicose veins are more than just cosmetic, which we're talking about now. They actually, in treating these, they're not vein abnormalities, vein blockages, is actually a type of preventative medicine long term.
That's true. If you don't prevent varicosities or varicose veins in the legs that are basically large superficial veins in the legs, you will end up having more serious problems down the line.
What could some of those problems be?
Eventually the skin and the legs, lower legs, get damaged seriously, and you end up with very discolored, hyperpigmented skin, and eventually you will get an ulcer, an open wound.
Oh, no kidding. Like within your leg, you have...
Yes, usually it will be in the lower leg, just above the ankle, on the inside of the ankle. It's very large. It oozes. It's a nasty wound to take care of. It takes a long time to heal. It has frequent bleeding. So prevention is the key.
And within this preventative form of medicine, because and I want to make it very clear, like you are a very well-respected and well-educated and practiced vascular and thoracic surgeon. You went to Bristol. You studied medicine in Bristol, England.
Correct.
Tell us a little bit about your background.
I'm originally from Persia. I moved to the United Kingdom back in the 80s, in 1984. Went to college there and medical school at the University of Bristol. Worked in Bristol for about a year afterwards as a house officer or intern. Then I came to the United States and did residency training and fellowship training for 6 years in Seattle and 2 years in the University of Rochester in New York.
And then what got you here to Ohio?
It was just a fluke. I knew somebody in the Youngstown area, and he asked me to come and join him to work at Northside Hospital in Youngstown. That didn't last long, and then I went on my own and started my practice in Warren.
So you actually started, and you still perform vascular surgery. Like, tell us a little bit about that too, because I think what's interesting, there are other, we won't mention them, but there are other vein places, vein treatment centers, whatever they are. But a lot of times they're not, they don't have the same level of staffing, for lack of better terms, because you are actually performing vascular surgery on patients in a life or death scenario.
That's true.
Yeah.
I do all aspects of vascular surgery. So, and venous surgery or venous disease is a main component of vascular surgery. But for years we've ignored venous disease because it's not a killer. It does not cause major mortality, but it does cause significant quality of life issues to people. Symptom-wise, it causes a lot of symptoms in the legs. So yes, that's correct. I do a lot of arterial work. I fix aneurysms. I open clogged arteries, whether it's open or endovascular. I still operate on the heart for pacemakers and draining fluid around the heart. And I still operate on lungs for different reasons, such as lung cancer or infection in the lung. But in Varis Vein Institute, we do everything as far as treatment of veins in the office without cutting, without any interruption to the people's lifestyle, without any incision, with no recuperation. So
I'm interested in, and I want to obviously talk about some of the procedures that you do, some of the new stuff that's out there, because you've always been one that's been like into staying as technologically advanced into the procedures, as you are making your offices comfortable and things of that nature. So it's very state of the art, for lack of a better term, some of the new treatments. But if you are these are some things that I learned from you. Most of your patients are female. They're about 35 and older. A lot of times people get spider veins or varicose veins from pregnancy or from standing. There are certain indicators that you can't really change, right? Like genetic predispositions or your biological sex. If you're a female, you tend to get more vein blockages. If you have leg trauma, like I was a soccer player, and so I probably maybe someday have to come see you, although most of my damage was up front. But if you've got blunt force trauma to your legs, that could create a blockage. But there's preventative medicine for varicose veins too. Can you just tell us some of that stuff too? Because I think for the people that already have the blockages, we're going to obviously direct them towards you. But if for those who don't have it yet, what are some of those preventative measures that they can take?
Well, as you said, a lot of people have venous disease. They may not have varicose veins yet, but they do have malfunctioning veins in their legs, and they are usually symptomatic. So you may not see varicose veins in your legs, but you may have a condition called venous reflux, where the valves in the veins are not working, and that results in symptoms or swelling or aching or throbbing A lot of people write that off. They look at their legs, they say, okay, there's no veins. Why should I go see a vein doctor? But a lot of these veins are hidden. They're under the skin. You may not see them. We detect abnormality in their function and we repair them in our office, and the symptoms improve, and you maintain your veins or prevent further problems down the line. So just the looks is not a reason not to see a vein doctor. If you have symptoms, if you have any issues, if your legs don't look right, if they're heavy, they're throbby, they're achy, there's burning, itching, any symptoms that are not quite normal, don't write it off as you're old, live with it, or put a pair of hose on and not look at your legs. Go see a specialist. And as you say, there are a lot of docs who do this. A lot of them don't even have vascular surgery background. They're family doctors, they're radiologists, they're other physicians, and they really have not seen a vein in live. They've never opened somebody up in the operating room and look at the vein. So they've really their experience is somewhat limited. But I grew up and I learned the trade, my training as a surgeon for years. We used to operate on varicose veins. It was a pretty morbid operation. We used to strip the veins. We used to make lots of incisions. It was fraught with complications. Patients had paresthesias, numbness, infections, wounds not healing, a lot of pain. Those have gone. It's 2019. Now we take care of these veins, minimally invasive, without incision, without cutting. It's all office-based. People on the whole, they drive from home, work, they come get it done, they go to work the next day. There is no interruption in their life. So I see it as a radical change in the treatment of venous disease. We have a very good team in our center at Varis Vein Institute. We have excellent ultrasound techs who are trained to look for venous reflux or abnormal venous function. We have a good team as far as our office manager who's very well trained in venous disease, and she knows the ins and outs, the symptoms, the treatment, the pre and post op management of these folks. So the whole team works as a unit. Without a good team, you can't succeed as an individual doctor. We have a great team at Varis Vein Institute.
Well, like that team, your comprehensive health care is important, right? So not only maybe detecting some of those symptoms that you don't see from a superficial standpoint. Oh, I've got, ropey veins in my legs. I have itching and burning. Are there other things that a person can do to, like, maintaining a healthy weight or not smoking or things of that nature? Like, what are some other things that someone can do to prevent varicose veins later on in life and those further complications?
To prevent varicose veins, sometimes you won't be able to do, because if you have genetic predisposition, you will eventually develop varicose veins. You can change that. But there are some steps you can take to postpone that as much as possible. If you're going to be up on your feet on a long shift, you got to wear compression stockings. You got to put your feet up as much as you can if you can. You got to move around and not stand in one spot too long. But most importantly, you got to check your veins, make sure your valves in your veins are functional and they're not incompetent or flailing. If they're incompetent, eventually you will have problems, despite all the measures you take to prevent problems. So if you have symptoms, or if you don't have, even if you don't have symptoms, but you're standing at a factory on concrete all day long, you got to check your legs. The beauty of going to a vascular doctor is not only does he check your veins, he checks your arteries, which is far more important. And he'll tell you if you've got clogged arteries. And then he says, by the way, if you've got clogged arteries in your legs, it's very important to check your heart. You may have asymptomatic coronary blockages you don't know anything about. So it's not a matter of just taking care of your legs. It's a whole combination, a holistic approach to taking care of the patient. As I said, our office, we do a great job of screening for other problems that are related to vessels in the legs. So we offer all kinds of screening to check their heart, check their arteries in the neck that may cause a stroke. We rule out aneurysmal disease that may take their life, things that people don't necessarily equate with veins in the legs. But that's why you go to a specialist. Anybody can set up shop and check for veins with an ultrasound. It's a vascular trained doctor who looks for other things that may actually impact the patient's life. So overall, I would say, if you're having a job that is demanding, your legs have symptoms, or even if you don't, go check with a vascular doctor. Once in a while, it's not a bad idea.
I found it interesting that it's when the symptoms already develop, like you see the symptom in your leg, you already have a problem, right? How often is it that you do find another complication, like you're saying, the arteries are clogged or your valves are, like what's the percentage-wise?
It's quite common. With technology as it is today, we find lots of other abnormalities. I can't tell you how many times a patient shows up or a person and they have no visible varicose veins. And quite a large proportion of them, I would say probably in excess of 50% of those patients who come to the office, they have venous malfunction. Their veins are not cooperating or working properly. So we'll find out which veins are malfunctioning or refluxing. They actually have reverse blood flow in them, and we'll treat them. Now, that ends up translating into better legs, less symptoms, less problems down the line. So if you wait until you're 70 or 80 years old and you've had malfunctioning veins, by then the disease has progressed to the degree that it's somewhat hard to reverse the clock. The tissue is damaged, the skin is damaged, you have the ulcer, or you're on your way to get that ulcer wound on your leg. Secondly, we also educate our patients a lot. You talked about other things that we should do to maintain our body, our machine. Yes, we should. We should not smoke. That's a big thing in our practice because we're vascular surgeons. We tell patients, if you keep smoking, you're going to end up in the hospital with a heart attack, with a stroke, or losing your leg possibly. You should not smoke. You should watch your diet. If you're diabetic, you should lose weight. You should exercise moderately every day. All the good things. Check your cholesterol. Don't eat too much junk. And be as active as you can. And that's what I see the difference. When I travel around the world, I'll look at people and we see the difference. The Europeans, for example, they smoke more. They drink more. They live almost the same length of time as we do. And they spend a fraction of budget on their health care. Why is that? They walk 10 miles a day. We don't.
So it's more sedentary lifestyle.
Correct.
Here in America that's causing some of these issues.
Correct. So on purpose, if I'm parking in a parking lot, I park as far away from the door as possible to walk. Now I see people fighting over a parking spot close to the door.
Yeah.
If you want to live long, you walk. In the hospitals, when I make rounds, I go up and down the stairs. I don't take the elevator. Am I tired? Of course I'm tired. Is it good for my heart? Absolutely. You got to do it every day. You got to force yourself. Diet, don't eat junk. If you like anything that is good for you, but it doesn't taste good, I'm sorry. You got to do it if you want to live long. You can treat yourself once in a while, but it's not going to be a daily habit of eating hamburgers. You're not going to make it. You should see the arteries that we open in the operating room or in the cath lab and what's inside the artery. Oh my God, you'll never touch a cheeseburger again, like if you see one.
What is inside? Describe it. Is it like a
fatty, almost runny, calcified yellow gunk? It just turns your stomach upside down. You want to throw up. Say, how is that possible? This guy was walking around with 99% blockage in his carotid artery and didn't have a major stroke. Well, he was one step away from a major stroke. He got lucky and he came into an office of somebody who knows what he's doing. But a lot of folks show up in the emergency room with a heart attack, with a stroke, having smoked 2 packs a day 50 years, not exercising, eating hamburgers day long, fast food. And diet, non-existent, sugar through the roof. What do you expect? Body's a machine. You have to maintain it.
Is that what, when people refer to plaque, like, there's plaque buildup in this person's arteries or veins, is that what it looks like yellow, gunky, that kind of crap?
There is several kinds of plaque, but Most commonly, they're calcified, has cholesterol, almost has a curdled cheese appearance inside the plaque. Plaque is very complex. It's not uniform. There are different types of plaque and different constitution inside the plaque. So every plaque is a little different. Some people are more calcified. Some people are more soft, gooey plaque that tends to break open and embolize and go other places. So there is different kinds of plaque. Overall, plaque is plaque. It will cause problems. You need to maintain it, prevent it if you can in the first place, and watch your diet and get a screening every now and then. I think it's good to get a screening. The difference between the first world and the third world is just that we screen people here for all kinds of diseases, breast cancer, colon cancer, prostate cancer, other problems. We should screen for vascular disease because it's the major killer, number one killer.
I was just going to ask you, is it still the number one killer in the United States?
Yeah.
Of course, you answered it.
Yeah.
What do you say to people who say, hey, your heart only gets so many beats in your lifetime, 70 beats per minute over X amount of time. I don't want to speed up my heart by exercising because I'm wasting those beats. Is there any truth to that?
No, absolute no truth. There's no truth to that whatsoever. In fact, there is a lot of evidence against that. In other words, if you stay active, you tend not to need a pacemaker, or you need it later in life than people who are not active. So activity for the body, for a machine, is good. For a vascular tree is good, for arteries, for veins, for the heart, for the carotid arteries, for the cerebral vessels. There is no contraindication as far as vessels in the body are concerned as far as activity goes. Activity eliminates and reduces the need for a lot of medical care.
You covered some of the things like what not to do in terms of smoking. Obviously, that's a no-no. Eating, Whoppers every day. Here's a disclaimer, we're not knocking Burger King or McDonald's, but Big Macs and Whoppers and fatty processed foods are probably a no-no. What are some things that you see that are good things to eat? If you're going to change your lifestyle, what's a good thing that you can start to introduce to your body that will help alleviate the plaque and help the blood flow a little bit better through your body?
Well, actually, we practice that in our office. I set an example in my office on what I eat, and I'm hoping that the office staff do the same. Jerry Germano, the office manager, she has a great diet. She does not eat junk. A lot of Mediterranean diet, salads, legumes, leafy vegetables, a little more basic diet, less refined, less processed food as much as you can. So I recommend, it's simple, like the Mediterranean diet, more fish, more white meat, less red meat, a lot of vegetables, a lot of fruit. Try to eat seasonal stuff too. Don't buy stuff that has been sitting on the shelf in the fridge or in a freezer at the grocery store for months, and they've got sulfur on them to preserve them all that time. That can't be good for you. I think you got to eat seasonal stuff. What's in season, eat. Don't eat junk. Don't eat fat. I know people say, well, what's the fun in that? But if you start your babies from early on, adapt them to that kind of diet, they don't want to eat junk. They won't enjoy junk.
I hope my wife is listening, because we sometimes succumb to my son's wants and desires for ice cream and brownies and things of that nature. Renee, we're going to start feeding him a little more hummus and a little more olive oil. How about red wine? Can we drink some red wine?
Yes, red wine is good.
That's that Mediterranean diet.
That's right.
I also read, I was reading before you came on about high estrogen level birth control, and how the CDC has recommended to maybe switch to low estrogen birth control because that can lead to blockages.
That's correct.
Yeah. And what about sun? They're saying less sun. How does that affect the veins, though? Like, we typically think the sun, like skin cancer, but does the sun or your amount of exposure to the sun actually change your vein or vascular health?
Yes, it does. It does damage the spider veins. It makes them more angry looking. So the components of the light, like the ultraviolet light, they penetrate the skin, and they do cause some damage.
Oh, I did not know that.
Yeah. So you got to protect not only your skin. When you put the sunblock on, you're protecting the tissue under the skin, the surface layer. So I think as much as you can stay, I mean, that's not a threat here in Northeast Ohio. We don't get enough sunshine. But if you do end up going to a place where there's a lot of sunshine, you got to protect your skin, cover up. If you look at the people who live in the sunny climate, they don't walk in the sun all day. They tend to go out when it's shady and cool, not in the middle of the day, and they cover their arms and legs pretty good.
Well, and we all look at Dr. Z and Jerry and myself, we're all darker complected. We all have dark hair and dark eyes. It's particularly important for someone that has less pigmentation in their skin, like my son, who took all the recessive traits from the Irish side, and he's fair skinned. So we try to tend to keep him covered up. That's truth to that?
That's correct.
Yeah.
They tend to be more susceptible to damage to the skin and the tissues under the skin. So the light penetrates more in their body than it does in your body or mine, because we're darker and we absorb more of the light on the skin level. So yes, they have to protect themselves. They have to reduce their exposure.
You had mentioned about, particularly like avoid standing for prolonged periods of time. What about wearing like loose pants versus, there's a trend now, or there was recently, these like tight painted on skinny jeans where it's like super tight. Is that good for your vascular health, or should we be wearing more like looser free flowing clothing?
I think if you have venous reflux or insufficiency, tight garments are actually good for veins.
Okay.
Because they help the vein function, because they're pushing the veins closed. But if you don't have bad veins to start with, then it's probably not a good idea to wear tight clothing, because it interacts with the vein function. It interacts with the veins that are superficial right under the skin, because it's pressing them. The deeper structures, the deeper veins and arteries that are next to the bone inside the legs, they're not going to be impeded because they're deep. But the superficial veins will be compressed by these. So if you have bad veins, good idea to wear compression stockings or tight clothing on the legs. But if you don't have bad veins, probably bad idea, because it impedes the flow of blood out of the legs.
How about like you're on a plane, you're traveling, 6 hours on a plane to California or whatever. How important is it to make sure you're not in a sedentary, like fixed position with your legs just bent the whole time or whatnot? How do we avoid that kind of stuff?
Well, unfortunately, it's unavoidable. And these days, it's getting harder and harder to move around in the planes, and the seats are tighter. But as a whole, I tell all my patients, if you're on a long journey, you got to wear compression stockings. And a lot of times I tell my patients, and I practice that myself, I take baby aspirin every day, but on a day that I'm taking a trip, I double that to try to reduce the chance of a blood clot in the legs.
And baby aspirin is about like 81 milligrams?
That's correct.
Yeah. Speaking of like taking, whether it be baby aspirin or supplements, are there things that you do in your own healthcare, or Jerry in your own healthcare, supplements that are good? Like I've talked about this in other podcasts. I suffer from ulcerative colitis, so my body does not absorb particularly minerals very well. So I take a calcium and magnesium ionized supplement, a drinkable form, so that I can get those minerals. Are there things that can help prevent, or if you already have these symptoms, is there something that you can take supplement-wise that can help alleviate some of the symptoms or prevent some of the symptoms from happening?
Right. A lot of people in our practice complain of night cramps in their legs. And if they don't have any vascular blockages, we check their veins and arteries, of course. If they don't have a vascular cause for the night cramps, we recommend replenishing their minerals. things like calcium, magnesium, zinc. So a multivitamin a day, especially in a climate like this where you're not getting vitamin D from the sky, from the sun. There is no sun. So everybody pretty much is vitamin D deficient. You got to take some vitamin D. In addition, if you don't eat a balanced diet, and that's the problem, you won't feel it, but the balanced diet that is not existing, then you're deficient in minerals and vitamins. So you have to supplement those. You have to take a multivitamin that has all those in it. So that's what I recommend to my patients.
Do you take sublingual vitamin? I mean, is that a better way to get it through a sublingual through a liquid form or through a tablet form? I mean, what's the best way?
I usually just recommend the oral, tablet version of it, and they don't have to be very expensive. Pretty much most of them are the same compound made by different companies and brands. As long as your GI system is managing to absorb them and you don't have any ailment like yourself, that cannot absorb it, that's different. But you have to take them by mouth. I think that's the way to do it. I don't believe sublingual multivitamins are a good way to go. It's not an emergency. You have time to digest it and absorb it through your bowels. So that's what I would recommend.
What about, because and I'm asking this question, I'm going to state it as a statement, but I'm asking the question, inflammation, right? So inflammation is a key factor in varicose veins and in some of this is like the pain and the associated the swelling and whatnot. Is that
correct?
So what about things that are, and this is interesting to me because of, what I'd said earlier, like my body responds to inflammation. It's a systematic response. It's not just acutely to, I have some pain in my left transverse colon. It's now I've got joint pain. I've got when my body gets inflamed, it's inflamed all the way. Things like turmeric or boswellia or fish oil or things of that nature. Are those things good in treating vascular health as well? Or are there, and if so, is there a limit? Like you can don't take too much of this stuff.
There is some evidence in the literature that some of these, what you just mentioned, like turmeric, has antioxidant in it. And we know in the vascular world that oxygen-free radicals circulating in your body damage your arteries. That's their job. Oxygen-free radicals damage the intima or the inner layer of the arteries. So if you have antioxidants that can damper those or absorb them and eliminate them from your system, you're reducing the overall exposure inside your vessels to all these free radicals, oxygen-free radicals. So there is some evidence. Some of these, like turmeric, for example, has some beneficial effect. There's no double-blind randomized studies on turmeric. So you can't find it and prove it scientifically and say, yes, there is this advantage this way or that way. But I know in a lot of cultures in the Far East or Mid East where they eat a lot of that, the incidence of coronary disease is way less. But they also don't eat hamburgers. You understand?
Right.
So the disease is multifactorial here.
Right.
It's different. It's very difficult to just pin it down and say, it's because they don't eat this or that. It could be many factors. Genes have a lot to do with it. People here, they have bad genes. They come from a line where the genes are prone to develop diabetes and heart disease, whereas some other places on Earth, the genes are very different. But when you look at people, one way we know food makes a huge difference is people who migrate from one country to the next. The first generation, they live like they lived in the old days in their own country. They live the same span of time. They don't get the acquired countries' diseases, but their kids do. So why is that? It's because their kids eat the new country's food. They don't eat the old style food. Like the Italians came from Italy. The Italians who came here, they keep eating the good stuff from Italy, or they try to eat the same stuff, whereas the kids and grandkids slowly start eating more fast food, and they develop the new diseases that they don't get in Italy. Mm-hmm. So a lot of it, those are the populations we look at and say, okay, yeah, these guys have the same genes, yet they're getting different diseases. And that must be environmental, must be food, must be air, must be dirty water, must be lack of exercise. It's very difficult to pin it down to one thing, but I think food and environment have a lot to do with our health overall.
Are there things that you see in your practice that are a common theme among, aside from genetics or, people who smoke are in my office more, or are there job types, or are there environmental factors beyond food, like this person works around a lot of toxic elements, or what are some of those things that you see that's a common thread that are not some of these other things that we mentioned, like they're working around chemicals, or they're...
Well, definitely environment has a lot to do with it. So if you work in an environment where there's a lot of chemicals, if you worked in a rubber plant or a dusty environment in your factory and you're inhaling all that dust all day long, you're going to get lung disease. There's no question about it. Everybody knows. Remember the coal miners, they all had silicosis.
Yeah.
It was all the dust they were inhaling. So environment has a lot to do with it. I'm sure there is a lot of other factors involved. We don't know exactly what causes what, but we know a lot of these conditions are multifactorial. If you have a genetic disposition, and you don't work out, you eat the wrong stuff, you work in a dirty environment. Remember the buildings that were set up here in many parts of the Rust Belt, they had asbestos in them.
Yeah.
Asbestos is a known agent that causes mesothelioma. It's a type of lung cancer. There's no good treatment for it. Now we know it. 50 years ago, we didn't know it. So it's very conceivable in 50 years' time, we'll know what we did wrong in 2019. We don't know it yet. We're feeding our babies formula. Who says formula is good for the baby? I don't know.
Right.
I think breast milk is probably the best thing. Millions of years of evolution have proved it. And we try to make our kids bigger, more athletic, more, to fit into a mold that is not necessarily genetically sound. So we get arthritis in our knees faster. Why?
Kids are carrying more weight.
More weight.
Yeah.
Yeah, they're doing stuff they're not designed to do. They're less active, so they're getting heavier. Or they have sports injuries. I don't believe you were designed as a human being to, lunge forward with your head with a helmet on and hit somebody in the side of their neck. That's not how evolution designed humans for. So there's going to be problems. We affect what happens to our kids and population, and in turn, that affects the diseases they get. And because we're so good at treating these diseases, they tend to live. In the old days, they didn't. The old days, you had a problem, there was no cure for it, you were eliminated, you died. Now we have diseases, we have treatments, we have people on dialysis for 30 years. It never existed 30 years ago, 40 years ago. You couldn't live that long. We have technology. Technology has made it possible for humans to live a long time with very serious health conditions. And that's good, and that's also bad because it sets in bad habits. An average person should not be huffing and puffing at the age of 50, going up 2 flights of stairs. They should be fit to go up 10 flights of stairs. But people say, oh, well, it's easier to take the elevator. It's not good for you. So you got to change your way of doing things and set an example for your kids. And try to, not being very strict, ice cream is good once in a while, not every day. That's where it's not good. Work out, really good for you. You know the difference. You work out, you feel energetic, you can stay and work longer that day because you have so much energy. But if you don't work out, after a while, you just your body just gives out. Slowly losing your stamina. So I think we don't know. There's so much about medicine we don't know. There really is.
Is that why they call it practicing medicine?
Yes, practicing medicine, the art of medicine, what you take out of your education, what you bring to the table to your patients. And the more we know, the more we don't know. And the wise ones know they don't know. you know. So there is so much uncertainty about certain things. And if you look at the literature, for example, there are things that are good for you, and they declare it, they announce it everywhere. 10 years from now, they say, oh, that was bad for you. Then 20 years later, they say, oh, that's really good for you. So you understand? Mm-hmm. Because we go through these cycles of doing studies on these things and finding out, oh, it's good for you, it's bad for you, it's good for you, because technology is changing, humans are changing, our habits are changing. But overall, I would say body is a machine, just like your car. Maintain it, prevent problems. All companies, if you know, they have scheduled maintenance. Your water pump works, doesn't matter. At 50,000 miles, they replace it. Because they don't want you to get to break it down at 56,000 miles on a highway someplace in the middle of nowhere. If you did that, you'll have longevity. If you don't do that, now I'm not saying to replace your body parts, but I'm saying maintain them at least, lubricate them, work out a little bit. Your lungs need exercise, your heart needs exercise, your brain needs exercise. Brain consumes more glucose than any part of your body. So that's not to say you just eat candy all day long, but you need to be able to exercise your brain, engage, not be just aloof and flaccid and not do anything all day long with your life. Even if you're retired, you got to do something to maintain. And that's one of the big things about, I look at the older people, and I learn so much from the older people. I actually get a kick out of talking to older people because I think that they know so much. When you talk to the older people, and one way you know that they're alive and they live long and they don't need a shrink is because they have so many friends and they talk about all kinds of nonsense all day long because their brain is continuously working. And as you get older and older, as their brain function goes down, they slowly lose the zeal to live. That's it's very important. It's in our DNA to be social, to talk to people, to talk about nonsense, to just keep rehashing the old stuff. So the stories that we hear at the office, they come and sit in our office for an hour, half hour. They're talking to complete strangers, telling them things from the old, Second World War, the Korean War, what happened 20 years ago, what happened to this, what happened to that. None of that is unimportant. It's very important. That's why they live. That's why they live longer. It's mind over matter. That's how it goes. So medicine is fascinating. I mean, we don't know a whole lot, and every day we find out we don't know more. It's truly that's one of the things that excited me about going into medicine. The fact that maybe I get a glimpse of knowledge, of knowing what it's all about. Medicine is philosophy. At the end, you say, what was it all for? So medicine allows you to think about that issue a little bit, especially when you have dire choices to make.
Well, you've touched on some awesome. I knew this was going to be a great, because I love the philosophical part of it, the ideology that you're sharing here. Aside from just like the Western medicine, people say this like, oh, Western medicine, it's either you're going to treat it, you treat the symptom, you treat the problem. It's like, oh, we're going to give it a pill or we're going to cut it out. But I love that you embrace the preventative aspect of it. And I love that you said mind over matter. Because I think that's something that we don't talk about enough, the placebo effect, right? Oh, hey, we were giving this guy a sugar pill and his symptoms improved. Well, and then we write it off and we go, oh, it's just the placebo effect. Well, okay, but maybe there's something to that. I mean, so it sounds like you believe that a positive mental attitude and thinking or feeling mentally, intellectually, I'm getting better, I'm going to get better.
That's true.
Is going to help the body overall, right?
Yeah. Actually, I'm very, very cautious when a patient of mine doesn't feel good about their upcoming surgery. I've seen that time and again. If you're positive, you do better. If you're negative, you don't do as well. And I always tell my patients, everything is going to be fine. Do my best to get you through. Make sure you won't have pain afterwards. But I want you to participate in a positive way, because that helps you recover faster. And I think there is something to it. I've seen it in my own practice. Negative people don't do as well. Positive people who are always encouraged to get better and they want to participate in their own well-being, they do better from major procedures. That is true. I mean, we know placebo effect is up to 60%.
That's incredible.
It's incredible. I mean, we see it in studies all the time. I read up on these studies all the time. This medicine versus placebo. And we see even placebo has up to 60% beneficial effect on patients. Why? There is no biologic basis to it. Not from the medication that they get, but it's from their mind. Their mind, the brain creates those endorphins or other chemicals, dopamine and other chemicals, and it makes them feel better. Well, we all know people can reduce their heart rates consciously. They can think. In the Far East, people are sitting around. They want to mellow. They don't smoke anything. They are so in tune with their body, they can reduce their heart rate consciously to 40. We can't do that here because we're not like them. We're not practicing what they practiced. But brain is amazing. It can reduce your heart rate, your blood pressure, your stress level. Your body will function better if your brain is telling them to function better. The heart, everybody thinks heart is just a pump. It's not. Heart secretes neuropeptides. These are hormones. You don't expect heart to inject the hormones into your system, but it does. It helps the function of the kidneys by the hormones it secretes. It's just amazing. Body is not as simple as we think. We get a glimpse of what it's like as a machine, what does what, but even in that department, they're not unifunctional. As I said, heart secretes endorphins, it secretes neuropeptides. The kidneys, they just don't clear your system. They control your blood pressure. They interact with your heart. They make the heart function a little better. They make other systems feel better. It's like you're like a community of neighbors helping each other. It's very, very complex. We don't understand everything. The little bit that we understand, we know that it's not a simple system. It's been in the works for millions of years. It's evolved to such a state where, and we can tell if the patient has a bad kidney, not only do they need dialysis, they are deficient in something else. Well, we thought that kidneys didn't do that at all. Yes, they do. Then they figured out that other systems are not functioning normal. Why is that? The heart is good, the brain is good, the kidney is no good, but yet now they have a new problem that we didn't know about. Well, yeah, because the kidney does something else too. So it's so complex. The more we practice, or I practice, and the more I see patients in our office, the more I realize it's a very complex system. We institute the same standard protocol for treatment of veins in our office. Responses are very different. And for the life of me, sometimes I don't know why. Some patients are so massively improved. Some patients are modestly improved. They have the same physiology, same abnormality. We fix the abnormality. We accept it just like science. We expect the same result. We don't get the same result. Why is that? Because humans are complex. There is more than one thing that is wrong with them. The brain, the heart, the lungs, the kidneys, the tissues, the lymphatic system. There's so much involved. You could fix your part. Doesn't mean that the result is going to be the same for everybody. And that's where individuality comes in. We all have a picture in our mind of medicine, the anatomy, the physiology, the pathophysiology, all of that. But you have to apply it to each individual. And every individual is unique. And it's not just, I'm not just saying that because it's in fashion. Every individual is a little different. And that's why you need to be open to exploring new ways of treating people, because every individual is essentially unique, very essentially unique. They're not copycats. Even if the only people who are copycats are identical twins. Those are the only people. But everybody else is completely unique, and no two people are the same. So you try to apply a model to something that is not uniform. How's that going to work? Not really good. That's the concept of individual medicine now. If you think about it now, we're moving to the next century.
Yes.
We're going to a world where you have one ailment exactly like mine. Your treatment is very different than mine because your biology is different.
That takes probably more time, unfortunately. And obviously we try to cram so much into so little amount of time as a society. I love that you're talking about the interplay between all the systems in the body, particularly your brain. And Pete, you had said like people who come in that are more positive about their health. Do you feel that those people are also more engaged in their health? So it's not just like, I go to the doctor. I think a lot of people think this way. This is the philosophy. I'm going to the doctor. He's going to prescribe me a pill that's going to alleviate whatever this symptom I have is. But we don't actually treat the underlying cause of it. Do you feel that people who are more engaged in their health and more, I hate to use the term disciplined, but they're disciplined because they're not eating garbage, they're exercising, they're not smoking, they're not putting crap into their body, they have a better result than people who are disengaged and just feel like, oh, I'm just going to get this pill to treat whatever that symptom is?
Yes, that is definitely true because they're more invested.
They're more invested. That's a better word. Mm-hmm. How about, we've covered a lot of biological factors and some things that are environmental. What about stress? How important, so do you meditate, or do you find that, and you kind of touched on it a little bit, where if you think you're getting healthier or you feel, I do this myself, this will sound like total weirdness, but I literally lay in bed at night if I have an ailment and I think I'm healing myself. I'm going to concentrate on this particular aspect of my knee or I've talked in other podcasts about, I do jujitsu, I'm 43, I've got inflammatory issues. I'm concentrating on reducing, I'm taking all the biological things too, the turmeric and things of that nature, but I'm healing myself. That's kind of a form of meditation. Do you feel like that is a good practice for stress reduction? These people who are stressed that come into your office, do they have worse symptoms?
Definitely. People who are stressed excessively, they tend to be more symptomatic because their body is hyper alert. That's what the stress hormones do. They make you more alert to your symptoms and your inner self. So if you're less stressed, you're not as aware. Your nerve fibers are not firing at high rate. But if you're stressed, at the slightest stimulus, whether it's light, cold, pain, whatever, you will be firing like crazy. And that means that you'll feel things that other people may not feel. Pain, for example, same thing. Stress is necessary for living. You need to have some stress. But the right amount of stress and the coping mechanisms are important. Excessive stress for a long time, it leaves a toll on the system. You look at our nervous system, it's nothing but electric circuits. And if you overpower it or inundated with information and signals, eventually you're going to have problems. I mean, you look at any circuit, it's going to have short circuits, it's going to break down. So stress is good in moderate levels, not in excessive levels. People who are stressed to the max, they tend to be more symptomatic, they have more pain, and that may be that they don't know how to cope with it.
Well, you said coping mechanisms.
Right.
what are some things that you do personally? Because when you're not doing the vein work that is minimally invasive and you have somebody's life in your hand, I don't know, I'm guessing, but that seems to be that's a high rate of stress. What you're doing could change it's a life or death situation, right? You're correcting an aneurysm or whatever you're doing. How do you personally, what are your coping mechanisms? Are there things that you do that can work for others?
Well, I try to do the opposite. Like when I'm at work, I'm very stressed because of the gravity of the situation I'm in. But when I am not at work, I try to shut my mind off. I try to stay active. I exercise regularly. I tend to laugh a lot at home, very opposite to what I do at work. And for stupid reasons. And it's designed to recover, to make me recover from 16 or 14 years of high stress job that I do. But mostly I want to make sure that the environment that the kids are growing in is semi-normal. I don't want to go there. I try to shut down and not talk because I don't want to talk after I've had a very busy day. But when the kids are at home, I try to make laugh at the smallest possible thing. I mean, stupid things. But it's not because I'm being dumb. It's because I want to make it as light as possible to make me recover, to let them laugh, to see that, hey, there is another side to this guy. This is not just a one-dimensional type of a person. But it's true. I mean, I can't concentrate at work if I'm joking around all the time.
Right.
Everybody does their job differently. You want me to do your job right? You don't want me to fool around when your chest is open. Not a good time to fool around.
Right.
You only have one chance. So I try to be, I look at my patients, they're my friends, they're my family, I have a responsibility to them. I promise them I will do my best. So you can make light of that. But at the same time, you got to balance it. Balance is the issue. Some people find balance better. Some people find balance not as easy. I try to be very focused at work because that's how I function. That's how I get the results that I want. If I don't do it that way, I won't get as good results. At home, complete opposite. I'm very irresponsible. Complete opposite. But that's intentional. I do it because I have to survive. I have to make it happen. I have to normalize. I have to recover. All of that is happening inside. And the environment around me, you affect everybody else. If you're tense and angry and all that jazz, you make it very, very unhappy environment. So I try to, it's not a big deal. It's at home, nothing is a big deal. It's like I used to say, my grandfather, there was flooding in the house and he was asleep. He wouldn't even, not a problem, that's water. Yeah? I mean, that's the attitude to have. But when you're at work and you have a serious job, you don't want to be like that. So, yes, exercise, go play something very strenuous that will get the anger out of you. Beat the racquetball, beat the tennis ball really hard. Break your racket, go run a marathon, do something. Don't sit at home and eat bonbons and drink beer. That's not a good existence. It's not good for the body. But that's how I do it. Everybody has a different way of doing it. I'm not saying your way is wrong. I'm saying my way is just for me. Right. It works for me, and I've tried it for many years. But your body needs to recharge itself. And I do agree with you. If you think about your knee, your mind, we talked about mind over matter, your inflammation may actually improve if you bring your stress level down. Yeah. Or you can direct it to reduce your stress level. There is a science behind it. Right, because cortisol increases your inflammation response in your body. Right. Yeah. And then the brain secretes those endorphins that reduce your inflammatory response. So you got all of that. Inflammation is good, whilst in low level. In high level inflammation, it's not good for the body. So like anything else, a balance is the key. And sometimes the balance is off and you have to reset that inflammation.
Well, I laugh when we are talking about you at home and respond, because you're very, every time I've ever visited the office, and probably it's been 24 times in the last, 8 or 10 years, you're very serious and very locked in. You remind me a lot of my dad. My dad is a very amicable, fun guy. As soon as he closes the door, he's a flight instructor. As soon as he closes the door in the airplane, it is all business. There's no, because he has your life in his hand. You're flying a small craft airplane. There's wind that you have to accompany for. There's all these different factors that can throw off the plane or whatnot. And so he's very locked in. So you remind me a lot in that scenario that when you're in a work mode, you're very locked in because you do hold people's lives in your hand. I'm curious, quick, I want to jump back just real quick. You had said about, you're obviously an intellectual. You're always educating yourself. You're always reading up on things. As a layperson, where can we go? Where do you go, or where do you recommend people to go? Like, is it the National Institute of Health.org? Is it PubMed? Like, where can someone like myself go who wants to dig a little bit deeper? They don't want to go to WebMD or some of these other places. They want to read scientific studies about some of these, whatever it is, whether it's heart health or whether it's brain health or whatever it is. Where can they go to? Is there a spot that you go to that you can read this stuff?
Well, I'm in a different category, so I have access to my journals.
Yeah.
I get my journals routinely, and I read them. But for public, you could join your library, or you go online and do a search. You don't necessarily join a good organization. And that way, if you want to read more detailed information, that's available to you. Or you can subscribe to different organizations and their journals. I don't know what type of person you're talking about, but average person, probably they can do a research online or at the library and find the information they need, the relevant literature, and they can get them at the library. Or they can join, if let's say you want to find out venous disease. You just go to the Journal of Vascular Surgery and you subscribe, and then you can read all the venous papers for the last year. And but there's going to be fee involved, obviously. I mean, I don't work for them, and I'm not telling you what to do, but there is all kinds of information now. What we have these days is too much information sometimes. Try not to just read the first paper on the vein disease and think that, oh, that's it, I know enough. Because believe me, that you have to read 10,000 articles and papers to find out what the truth is. Because everybody is biased to some degree. They have their own bias. So you have to read the whole gamut of things to get an idea of what works, what's real, what's the current state of affairs in any problem. The same with anything else. Like anything else, you want to buy a car, you don't buy it from the first place you go to. You ask around, you go to different places, you shop around, you got to do your research. So the same applies to medicine and other things.
So for our listeners out there that are in the local area or outside of the local area, and you've gone and you've got some symptoms, you've got swelling in your legs, or they're itchy, or you think that you may have an issue, and you go and get checked out. Are you prohibited? You may think that you're prohibited from getting this treated because it's oftentimes associated as like a cosmetic thing. Oh, look at that person's vein. They have these veins. So I'm asking both of you because my co-host, Dr. Z's office manager, has not chimed in yet. So here's a question for you. Are these, if I come into your office, are these treatments covered by insurance? Is my major medical going to cover this, or am I have to pay out of pocket?
So, Jim, I can answer that. Basically, our team is specially trained. So the whole idea is you want to come in. That's why we advertise free ultrasound, just to educate you first off and let you know what you're dealing with and what Dr. Z can offer you as far as treatments go. And then we do have the option to go ahead and access your insurance even prior to, give you some idea. Most insurances, I'd say 98%, cover the treatment that we're able to offer you. But we can even go as far as to look in to see, where you are as far as your deductible, what you need to, be prepared for out of pocket, if there is an 80-20 coverage type, what have you. But we fully make you aware of what those costs are. and we authorize prior to. So there's no procedure done without an authorization.
And so, like, okay, I'm 75 years old. This is hypothetical. Obviously, I'm not 75. I'm 75 years old. I'm on a fixed income. I'm having some issues. Okay, great. I found out now by listening to the podcast that this is probably covered by Medicaid or Medicare. But now, because it's kind of like I went to the dentist today, I don't want to be in pain. My dentist is very good. I wasn't in pain, but I don't want to be in pain. Earlier, you had talked about some of the procedures years ago, the vein stripping and the things of that nature. Tell our listeners out there now, there are other new treatments, and what are some of those treatments that are non-invasive, where you're literally, out there the next day back at work, where you're not sitting for, a week or even 4 or 5 days with your legs propped up and ice packs on it because you've got some invasive, painful procedure. What's out there now that is new, that you've seen in medical science transpire over the last 10 or 15 years that can really help people?
Well, in the old days, we used to strip veins.
When you say strip veins, what does that mean? You're cutting the leg open and taking the veins out? What is?
Correct. We made incisions in the leg, up and down the leg, and we would strip the malfunctioning vein out of the leg, mainly because the malfunctioning vein was causing damage to the leg. And we do the same today, except no incision is made, no vein is taken out. The vein is treated with either heat or injection of a medication, and we basically correct the problem in the vein without doing the surgery that used to be done. So you get all the benefits, no side effects, pretty much. It takes about 15 minutes to treat the vein. You don't have to miss work. You don't have to change your lifestyle. You're not hospitalized. You're not going to outpatient surgery center. There is no incision made. There is no anesthesia except one pinch of maybe lidocaine, which is just a local anesthetic, before we actually insert the needle in the vein. Everything is done percutaneously through a tiny needle inside the vein, and we can do the laser treatment. We actually float the laser fiber. It's a fiber optic fiber inside the vein, the malfunctioning vein. We're not closing the veins that are good. We're eliminating the bad veins that are causing liability to the leg. And we will laser that vein closed. That's the idea, to close that vein so it doesn't have reverse blood flow in it anymore. There's lots of other veins in the legs. We're not eliminating circulation. We're actually improving the overall circulation to the leg. For some other veins that are not amenable to heat treatments, but whether it's radiofrequency or laser, we can inject them with a medication called Esclera or Polydaconol or Varithena. These are all pretty much the same compounds. And we inject them into the veins and we eliminate the veins. So what will happen if you have unsightly veins? They will collapse and disappear. If you have symptoms, your legs will feel better. Less aching and throbbing and heaviness and cramping. And people say, I have restless legs. A lot of time restless legs comes from the bad veins. So the restless legs improve. The swelling goes down. You could wear your shoes on shoes that you never could wear because your feet were swelling before. So there's a lot of good results coming out of it. And as I said, we get a lot of thank yous after we take care of people's veins. Pretty remarkable, to be honest. And where I go to the hospital and do emergency surgeries to save somebody's life. And because they don't feel the difference very much, and sometimes they feel even worse because they just had surgery, major surgery, they are not quite in sync with what happened. They don't tell you thank you as much as they do the folks that come in the office, because they notice the difference in their legs. Their legs not as tired and heavy anymore. So they tend to be more grateful as opposed to standard patient that we take care of in the hospitals. But yes, I mean, this is the science of technology. The technology has made it possible that we achieve 97% cure rate in venous disease without cutting. It's pretty remarkable.
Yeah.
20 years ago, when I first started working, we had to hospitalize people to strip their veins for days. We used to have problems with those incisions. Now we eliminated the incision, eliminated the cutting. Patients don't lose work. They don't have to take time off. As I said, they walk in the office. They come after work sometimes. We stay until late in the evening because they're working. We stay until they're done with work. They drive to the office. They walk in the office. 15 minutes later, they get their legs done. Then they get up. They drive home. They go back to their workout that same evening if they want to, or they go to work the next day. There is really no change in the lifestyle. And that's the way things are going even now with everything else. And at the very, what's the worst case scenario? Patient shows up, we check their veins, there's nothing wrong with their veins.
And it's free. The consultation's free.
Yeah.
You come in, they're going to check your veins to see if you have an abnormality or some type of...
The ultrasound is free, and then the follow-up to get those results are free as well.
And the added bonus is that I'm a vascular surgeon, so I tell them, by the way, I know you didn't come here for your arteries, but your arteries are wide open. Well, that's
So
good
you
to
get a
know.
little added bonus
Yeah,
there.
not bad.
Not bad.
Your arteries are wide open. If you have pain in your legs, it's not from your arteries, from your veins. How's your back? Do you have any lumbar discs that you know of? Do you have any arthritis in your lower back? Do you have an arthritis in your hip? And oftentimes, that's the cause of their leg pain. And I'll refer them to an orthopedic surgeon or a neurosurgeon to evaluate their back and their hip and so on. So it's good. It's good to get it okay and then go see somebody who can fix your back or your leg pain. It's good to know that you don't have blocked arteries. And if you have bad veins, which is actually very common, we see quite a bit of that in this area. Actually very surprised by how prevalent it is. When we do ultrasounds on the leg veins, we see very often quite a large proportion of people have venous reflux or reverse flow in the veins, and that's not normal. That will cause problems, eventually catches up with you. So it's good to know that you're okay, but if you're not okay, we're there. We can fix it without changing your lifestyle, without any side effects.
If you are in Northeast Ohio, in the greater Warren-Youngstown area, or you live in Western Pennsylvania, Sharon, Hermitage, Newcastle, Greenville, etc., or even if you're outside of the area, Dr. Z you can travel in and see him. But where can someone find more information about Varis Vein Institute, about your locations? Where do we go? If someone's out there and they need help, where can they go?
Go to the website, varisvein.com, VARIS, Vein, VEIN.com. Everything you need to know is there. You can contact us, email us.
Is there a number that they can call also to schedule an appointment?
There is. They can call 330-856-4366. That's our Howland facility. And even if you call the Hermitage number, 724-979-4664, it's answered at all times. If we're not there, it rolls to the main office. So we can definitely get you set up for that free ultrasound. We have 4 specially trained ultrasound techs. We're an accredited vascular lab. There's no reason why you can't take advantage of it.
Awesome. This has been a very informative podcast. I hope the people that are listening got some information that they can use. And you don't have to be 70 or 80 years old to have this problem. A lot of young people are having this problem because of their lifestyle, because of their environmental factors or their genetic factors or their work environment, or they're women who are pregnant and they have vein abnormalities. So if you're outside of the area and you can't make it to see Dr. Z or Jerry at Varis Vein Institute, please go get yourself checked out because it could long-term affect your health and help you. Dr. Z, thank you for coming on today.
You're welcome.
And Jerry, thank you for coming as well.
Thank you, Jim.
And sitting in for Brandon Giovanni, who was not able to make it today. If you have listened today to the end, the secret code for free coffee, if you share this broadcast today on social media and you post the words cold brew is the coffee, we will do a drawing and we will send you free coffee for the day, courtesy of Starbucks, who we are not affiliated with by the way, but we will send you a free cup of coffee, and you can visit some of these great sites that Dr. Z has laid out for you and research about your health. Until the next time, Prodders Podcast Universe, stay healthy, stay out there, keep listening, and stay electrified. Thanks, guys, again for coming today. It was fantastic.